Brad Williams, Frugal Finance, Medicare versus Medicaid. Key differences and coverage overview. Medicare and Medicaid are both vital healthcare programs in the United States, offering coverage to specific groups of people. Although they are both government funded, their eligibility requirements, coverage options, and costs vary significantly. Understanding how they work is important for individuals who may need assistance with healthcare expenses. Medicare overview. Medicare is a federal program primarily designed for people age 65 and older, as well as those with certain disabilities. Unlike Medicaid, Medicare eligibility is not dependent on income. The program consists of 4 parts, each offering different types of coverage. Part A, hospital coverage. Part A helps cover hospitalization expenses. Most individuals qualify for Part A if they or their spouse have worked and paid Medicare taxes for at least 10 years. Most beneficiaries don't pay a premium for Part A, but deductibles and coinsurance may apply. Part B, medical insurance. Part B provides coverage for medical necessary services such as doctor visits, lab tests, and outpatient surgeries. It also covers preventative services like screening and vaccinations. A monthly premium is required for Part B, with the standard amount being $185 in 2025. There are also deductibles and coinsurance costs. Higher income individuals may face increased premiums. Part C, Medicare Advantage. Medicare Advantage plans, Part C, are offered by private insurers and combine coverage from Part A and Part B, often with additional benefits like prescription drug coverage, vision, hearing, and dental care. Many plans also include lower out-of-pocket costs for in-network care. Switching back to original Medicare from Medicare Advantage can be complicated and might require medical underwriting. Part D, prescription drug coverage. Part D offers prescription drug coverage through private plans. Participants must pay premiums and deductibles with copays for medications. Most Medicare Advantage plans include prescription coverage, but separate Part D plans are generally not available for those enrolled in Medicare Advantage. Medicaid overview. Medicaid, in contrast, is a joint federal and state program designed to assist low-income individuals and families with health care costs. Unlike Medicare, Medicaid eligibility is based on income, and each state has its own rules and regulations. Medicaid covers a wide range of services, including hospital visits, outpatient care, preventative service, and long-term care. Eligibility for Medicaid can vary significantly by state. However, under the Affordable Care Act, states that choose to expand Medicaid coverage extend eligibility to individuals with incomes up to 138% of the federal poverty level. People who qualify for Medicaid might not pay for covered services, but the specific benefits and eligibility criteria can differ from state to state. Medicaid also includes the Children's Health Insurance Program for families who earn too much to qualify for Medicaid but still need low-cost coverage for their children. Medicaid may also fund long-term care, including nursing homes, which is not typically covered by Medicare or private insurance. Who can qualify for both Medicare and Medicaid? Some individuals may qualify for both Medicare and Medicaid. People who are aged 65 or older, or those with disabilities, are eligible for Medicare. If they also meet their state's income requirements, they may qualify for Medicaid as well. This dual eligibility is common for low-income seniors or individuals with serious health conditions, such as end-stage renal disease or ALS. For these individuals, Medicaid may help cover additional costs, like Medicare premiums and copays. Key difference between Medicare and Medicaid eligibility. Medicare primarily serves people 65 and older or those with specific disabilities regardless of income. Medicaid, however, is for low-income individuals of all ages. Coverage. Medicare is divided into 4 parts, each covering specific services. Medicaid provides a wide range of services based on state eligibility and income levels. Cost. Medicare premiums and out-of-pocket costs can vary, while Medicaid typically requires no payment for services, although some states may require small copays. Conclusion: both Medicare and Medicaid are essential programs that helps millions of Americans with health care costs, but they serve different populations and have different coverage rules. While Medicare provides coverage for seniors and people with certain disabilities, Medicaid is for individuals with limited incomes and resources, often covering long-term care. For those who qualify for both programs, Medicaid can help with costs not covered by Medicare, ensuring that essential care is accessible. Comment if you have any questions as it relates to Medicare versus Medicaid. Brad Williams, Frugal Finance. Thanks for watching. Hope that helped. See you soon.